guys, this is Megan with Duck Cup Memorial. We're going to be starting a new interview/conversation series every month that goes in line with our topic that we've been covering with our social media posts. And this month is Suicide Prevention Awareness Month. So today we have Emily Lake Schuleman with Secure-Based Counseling Center. Right, yeah. And she is going to just be having a conversation with me about what she's seeing in our community, and as far as what she can provide through Secure Base or other counselors and therapists to help with everyone in our community and suicide prevention.
Yeah, absolutely. Hi, everybody. Thank you for watching this video. This is a very important topic. So glad that we were able to do this, get this set up for this month, because this is something that could change someone's life. So glad to be here. A little bit about me. My name is Emily Lake Schuleman. I'm a licensed professional clinical counselor. I have specializations in treating trauma, postpartum care. I've worked with people across the lifespan. So my youngest clients have been 3, all the way up to the lifespan. And I'm so happy to be here and talk about therapy because obviously I love talking about therapy.
Yes, and thank you so much again for being here. I guess to get started, I wanted to just check in with you and think or ask for people in our community specifically, or just in broadly, that have never been to therapy and aren't sure what it involves. How would you explain that in simpler terms as a therapist?
Yeah, I think that's a great question. I hear this a lot whenever I go talk to people in the community. I hear, why would I go talk to a stranger about what's going on? And the reality is, it's not just a stranger. It's someone who's trained and has specializations to help you through that talking. And so what therapy does, it is an evidence-based intervention that allows you to have a safe space to talk about all the things that maybe we don't feel comfortable talking with our family, with our friends, with other coaches or other people in the community, because we feel stigmatized, we feel shame, we feel guilt that we're having these experiences or we've had these life experiences. And so going to a therapist is just a neutral party that is in your corner, that has your best interest and can provide you with different skills along with that support. And so that's kind of the misconception that I hear of, oh, therapy, I'm just paying someone to listen. Yes, and they also have all of these skills in this training to be able to give you valuable feedback, skills, all of those things too.
Awesome. I think that'll be really helpful for some people, because I think there's just so many people that have never been to therapy, and it's kind of just like I just sit and talk to someone, or why would I, like a stranger? And so it's just, I thought that'd be good for people that just have never heard an actual therapist explain, what are you doing exactly, or why, or So thank you for that. Another thing I know personally that I've heard from people that talk about, or maybe do need to start talking to someone, but they're kind of off-put by when they see talk around trauma, or they might think well, I don't have trauma, I haven't been on anything in my life that's traumatic, or maybe they just discount their own experiences a little bit. So what kind of experiences are you actually could be considered trauma, or why should people consider that?
Yes, I think trauma, the word trauma is a really hot button word right now, right? We see a lot of TikTok videos, we see a lot of articles, a lot of media exposure around the word trauma. And so I actually like to reframe this word, because this is kind of, if we're looking at it from a perspective of this is a clinical word, I like to reframe it as, do you have events in your life that you're stuck on? Maybe through therapy, we identify them as being trauma, or maybe they're just events that we need to reprocess. And so I do hear a lot of people get stuck on that word. And in those services, I like to, in being trauma trauma informed and trauma being a specialty, I also like to rephrase that because there's so much more than the word trauma.
Awesome. Yeah, no, that makes a lot of sense. I think that'll be really helpful for some people to kind of think of it, frame it that way. Like, just because you don't feel like you've experienced trauma in the way that others in your life have, or people that you know for sure, like, oh yes, that was a very traumatic experience for them, doesn't mean that you're not affected personally by things that have happened in your life, and that might be a trauma to you.
Yeah, absolutely. And it goes back to like our perceptions about events, right? You and I can go through the same experience and have completely different perceptions about that specific thing that happened. And it doesn't mean that any one of our experiences is invalidated. It just means that our experience on this common theme or this common event is different. And so for you, like, you might be okay calling it a trauma, whereas I'm not okay with that. And so what you will find is a lot of therapists will utilize your language. And so that's another misconception that I think happens with therapy of, well, I don't want someone to tell me that I have experienced trauma when I haven't. Absolutely. That is not our goal. Yeah. Our goal is just to help you with what you are presenting in the session.
Sure. Okay. Does that play into when we see, like, on your website, it talks about being like person-centered?
Yes.
So when someone's like in a therapy session, is that what you're kind of talking about when you say person-centered? Is focusing on each individual person?
Yes.
Okay.
Yes. So what person-centered mean? Again, like, I love that we're doing this because we're kind of getting into the therapy lingo and then what it actually means. So what person-centered essentially means is that you're the primary focus. It is your session. You hold the agenda for that session. And the therapist is there to hold that space for you, to be a support for you, to validate you, to challenge you. But ultimately, it is about you. And so that's what I say a lot with clients that I'm working with. Like, maybe I have a suggestion, or maybe we're talking about skills. I always reframe that into, it's not about me. It's about you. Is this something that you want to do? Or is this something that you want to try? And so that's what that person-centered means. Therapy is the opportunity for that hour. It gets to be all about you. And for some people,
and that's okay.
And that's okay, right? And for some people, that holds a lot of power. This is my hour where everything can be about me.
And some people, it might be hard for them too, though, right? Because it's really hard for them to be that selfish. They might think they're being, but it's really important. So thank you. Yes, I really appreciate getting into that, because I think it's really important that people just kind of have that explanation. So connecting all of this to then our topic of the month, which is suicide prevention, how does regular therapy help prevent a mental health crisis before they happen?
Excellent question. And so as therapists, that is our ultimate goal, right? We're constantly assessing. Yes, we talked about kind of the fun stuff related to therapy, right? Person-centered, it's all about you getting to learn new skills. And throughout each of those sessions, we're also clinically trained to look for warning signs, right? To look for warning signs, to hold space for some of those topics like suicidal ideations.
Can you explain what that is? Or can you just say kind of like
absolutely
what that is? Because we hear that a lot, I feel like, lately. And I know now what that means, but I think when I first started hearing that, I was kind of like, so suicidal, is it basically the same? Like, when someone says someone's suicidal, is that the same thing, or is it different?
It is different. So what suicidal ideations mean is sometimes our brains send us these messages or have these thoughts that feel really out of control for us. And so what that might look like is having this thought of something bad happens at school, and I just have the automatic thought, oh, I should die. That would be a suicidal ideation. And so a suicidal ideation doesn't necessarily mean someone is suicidal. It means that their brain goes through this thought process. And so having regular therapy is an outlet, because if we name it, if we talk about it, it becomes less intrusive. We also can identify skills to help us with those suicidal ideations. I kind of use the reference of dark clouds, right? So sometimes we're sitting, it's a beautiful day, and there's this dark cloud that passes. And it doesn't have to mean anything, right? It didn't ruin our day. It didn't ruin our experience. It just happened. And so sometimes we're able to get clients to where their suicidal ideations are like that dark cloud, right? Oh, I see it's there. It's impacting me in this moment, and it's gone, right? Other times, if untreated, those suicidal ideations can develop into more of that suicidality, or we're starting to exhibit some behaviors, okay? I know what some of you guys are thinking. Some of you guys might have automatically gone to self-harm. We're going to talk about that, because that doesn't necessarily mean we're suicidal. But that suicidality means that thought becomes more invasive. Now we're thinking about a plan. Now we're thinking about an action. Now we're implementing those actions, right? Of writing letters, giving away things. And this is when we're getting into that crisis mode. So if we're in regular therapy, our goal as therapists is to prevent that crisis. And sometimes it's unpreventable, whether it be due to certain mental health disorders, or we just need more intensive care. But if you're in regular therapy, it allows the therapist to be part of that intervention. Okay. Talking to you parents. I have worked with parents, and this is really hard. It is really hard for you to be that interventionist when your child needs that help. It's nice to have someone in your corner. Yeah. And this is where therapists can be part of that conversation. We can be part of that conversation with the client. We can be part of that conversation with the care team, meaning the professionals that they're going to, and also a part of you as the care team for your child, or a significant other, or a family friend.
Sure. So you mentioned self-harm and how that's not suicidal ideation. That's not, doesn't mean someone's suicidal. Can you go into that a little bit more?
Yeah. So self-harm can be really complicated, and it can look like a plethora of different things that someone is doing to their body. And a lot of times we lump those into the same category. So if someone is self-harming, they must have suicidal ideations, or they must be creating a plan to die by suicide. Not necessarily. So sometimes what happens is we have these intrusive thoughts. So we talked about the suicidal ideations, we named what those are, and then we have those feelings with those thoughts, and we don't know what to do with them. So we kind of figure out how to cope, and self-harm gives us relief in that moment. And then our brain makes that connection of, oh, this made me feel better when I experienced this thing, so I'm going to keep doing it. And that's where we get those urges to self-harm. And this is where intervening either before or whenever you know that either you're self-harming, or maybe your child is self-harming, or another loved one is self-harming, this is where having a mental health professional be a part of that could be really impactful. Okay. What I hear from teens that I've worked with in the past is there's kind of this fear factor of, are you going to freak out? Are you going to freak out if I tell you this? And so that's part of what we do, right? Like, we're kind of that neutral party that's like, I hear that. All right, let's try some new things, right? And it allows for a space for clients to feel comfortable to come into that space and tell us what's going on. So that way we can come up with new interventions, new skills. We can talk about why those things came up for them, different perceptions that we can take, different cognition work that we can do. And so this is where that mental health work becomes so impactful.
Yeah. Okay. Absolutely. Well, for people that we've been talking about that have never been to therapy before, or they've been on the fence, or just not their thing, or they have a loved one that just hasn't wanted to or hasn't in the past, what are some like really important warning signs that people can recognize in their children or like adult loved ones as well, in terms of those like possible like suicidal ideation like you talked about, or just deep depression? Like what are those warning signs that they should look for to really be like, no, we need to do some more about this?
Absolutely. Let's be honest, we all live really busy lives, right? We're all booked to the max. We are in multiple different activities, whether that be like us as adults or our kids. And so we kind of get into this groove of this everyday schedule. And that's really important. However, I think sometimes we kind of lose the mindfulness of what is happening in the moment. So let's split these up into adolescents and adults. Adolescents are elusive. They go in their rooms. They don't want to talk to your parents because your parents, right? Friends no more. all of that is normal developmental things. Whenever we think about us as teens, right? We did all those same things. So with adolescents, it can be really hard. It can be really hard to know what is normal, what is not normal. However, you know your child, right? And so if you notice they're in their room just too much, or they stopped coming for dinner, or whenever I ask them questions, they at least give me a sentence, but now they give me one-word answers. Listen to those gut feelings. It doesn't mean that they're suicidal. It doesn't mean that they're having these thoughts. However, it can mean that something is going on, whether it's relationships, whether it's depression, whether it's anxiety. It just means that something might be happening. And so starting there could be a really good point in intervening, right? Getting an outsider's perspective on what's happening, allowing your child to talk to someone else who maybe they feel more comfortable with at that time. Let's go into a little bit more warning signs, right? So that's kind of the first one where maybe we're noticing some small changes. Well, then maybe we're hearing something, if you're really involved with your kids and their parents, maybe we're hearing some things that just sound off from other people's parents, or messages that are being sent from your child to another friend, right? Listen to those. Listen to those. Here's what can happen, I think, a lot of times whenever parents confront their kids about these things is, oh, I didn't mean it. I just did this. And then we kind of brush it off, right? Kids will be kids. Get into therapy, right? Get into therapy. Worst case scenario, that's true, right? And you spent this hour with someone talking about it. Worst case scenario, it is true and they do mean it. And we got them into the space to have those safety measures, okay? What can sometimes happen is we have a child who has done these things, or an adult. This goes for an adult as well. We have a child or an adult that they seem to be in this depressed mood, and then all of a sudden we see this, oh, they're better. They're themselves. Megan is letting so-and-so borrow her clothes. Everything seems to be normal. That can actually be a huge warning sign. For clients who have suicidality, there can be this uplifting mood when they have finally made the decision. Today is the day. And so that can be a big warning sign. I also want to be very clear that these are just warning signs, and these don't always mean these things. But this is why it's so important to seek out help, seek out a professional. Let's look at adults, okay? Heavy drinking. That alcohol is a depressant. If you notice your friend or spouse is drinking heavily and kind of vocalizes maybe some unsafe thoughts, but then the next day they're like, I was just drinking. That can be a warning sign, okay? We have to take into account all of these factors. And really, if you can kind of go with the assumption of, if I don't know, then I'm going to seek help, that can really make an impact for whatever is going on, whether it's just depression or anxiety, or I got in a fight with my boyfriend and I don't know how to handle it. Getting into therapy can be a prevention component. It's not 100% of prevention, but it can be a prevention component to all of these other risk factors that I just mentioned. Another big one, I mentioned Megan giving away her clothes, giving away items, writing letters. If you ever find a letter, please, please, please go to the ER. I know that can be really scary with your child, but that means things are more serious and we need to seek that intervention. If we're noticing that we just feel like they can't keep themselves safe, go to the ER. Okay, that's kind of this category. If we're noticing these other things that I mentioned and we can get in fairly quickly with an outpatient therapist, go see an outpatient therapist. Seek their advice on these things. And so what I do want to talk about is a little bit more about what that outpatient therapist can do for you. Okay, so let's kind of talk about interventions that could happen. There's lots of different evidence-based interventions that can occur, but the most important thing that therapist is going to do is make sure that everyone is safe. Okay, so we kind of go under a hierarchy in therapy. Safety is the number one. So that's what we're going to assess for. We're going to make sure that everyone's safe. Once we identify that everyone's safe, we're going to start talking about these other intervention models. One of the biggest ones is dialectical behavioral therapy. Have you ever heard of dialectical behavioral therapy?
I've heard people mention or just say DBT. So that is that.
Yes.
Right?
Yes,
Okay.
that is that.
But I don't know. Yeah, I don't know anything about it. So this is a learning experience for me as well.
Okay. Therapists love their acronyms. So yes, dialectical behavioral therapy, also known as DBT, was created for this. So DBT was created for clients that have high suicidal ideations, suicidal behaviors, self-injurious behaviors. And so what that model does is it teaches very specific skills to help adolescents and adults manage those thoughts and those feelings. As someone who works on our dialectical behavioral therapy team, I've been doing DBT interventions for almost 10 years now. It is a really cool therapy model. It is it's a very heavy intervention, and it's really cool to see how it changes people's lives in learning these new skills and being able to deal with some of the things that they deal with on the inside. So that way they can do the things that they want to do on the outside.
Yeah. Okay. That makes sense. Are there any other therapies or ways that people could expect to experience when they're in therapy if they've gotten to that point with this?
Absolutely. So I kind of talked about this hierarchy of therapy, right? So our main focus is making sure that the client is safe. So once the client is safe, we can go in and look at what is the best intervention for you. So as mentioned, I'm a trauma therapist, right? The majority of my clients who come to me for very specific reasons. And a lot of times it's due to trauma. And so what I kind of look at is, okay, we're safe, we're having these things, and we're having these symptoms, these things due to our trauma. So let's put some things in place to make sure you're safe. And then let's really dig in to the core of what's causing these symptoms, right? And so that's my thought process. But that thought process can go kind of with anything, right? So let's say it's anxiety. The core of the symptoms stem from this place of anxiety. I feel like I'm not good enough. So then when I can't perform, this is my thought. Well, we can identify some strategies to ease that anxiety. We can start challenging that narrative that we keep telling ourselves. So that's something called cognitive behavioral therapy, where we're challenging our negative thoughts. There's so many different interventions that can be done. I mean, ultimately, that could be a series in and of itself, like every month. where a different intervention is discussed. But I use those examples to let you know that this is why you're coming to a mental health professional, right? Because they have these trainings in all these different areas, and they can help identify the core of what's happening. A lot of how I kind of explain this to clients is we have the content and then we have the process, right? So a lot of times clients come into me with the content. The content is, oh, I failed a test today. I feel like I'm not good enough. I feel like I'm not going to go to college. Okay. What's the process? The process is I feel anxious. I have fear, which also causes sadness. So we're going to focus on the process, right? And so getting into that core is what really drives that growth and that helpfulness out of therapy.
Sure. And it's just not a one-size-fits-all thing,
No.
right? It's everyone can expect a different experience or try different therapies, like you said, and just because you might hear from a friend or someone you know that like, well, they went and they did this and maybe it worked well for them, but it doesn't sound good to you, or they had a negative experience. Maybe it's just like important to not let that stop you from reaching out to someone like you or another therapist, because there are so many different ways that they can help and really go off your personal experience, your person-centered care, right?
Yeah. And I think that's a really good point, because I hear that's sometimes something that I hear of, oh, I had a negative experience with another clinician. Not all clinician is size fits all, right? That's why we all have different personalities. We have different experiences. We come from different backgrounds. We all have our own stuff, right? That contributes to like who we are as therapists. And so I really encourage people, if we had a negative experience, we can't really take that and put that on all therapy is bad.
Right.
This one experience was bad. It doesn't necessarily mean that there's not a clinician out there.
Sure. We're in New Prague here, rural community in Minnesota. Do you find that there's like certain or better ways for friends and family to reach out to their loved ones that may be, experiencing some of these things, or if they're noticing these things in them specifically? Like, I know that sounds kind of specific, but it is different, right? Like, it's a small town, we're like out in like country folk, right? Like it plays into it. So what do you have to say about that, or feelings on that?
As someone who grew up in a rural Tennessee town, if you haven't noticed, I do still carry some of my accent. Growing up in a town very similar to New Prague, I think this is a really good topic for us to talk about, because it is different, right? In the city, mental health is kind of more widespread talked about. It seems to be a little bit more accepted, whereas it doesn't necessarily mean in rural communities mental health doesn't happen. It just means it is a different perspective on mental health. And so that goes into how we talk about it, how clinicians, we present it to our specific clients. And that is one thing that I love about our New Prague office here. A lot of our people are from communities very similar to New Prague, or live close to communities that are in New Prague. And so I think that's really beneficial, because we know, right? Like, we know that mental health is not something that's been talked about in your family, or going to therapy still might feel very stigmatized for you. And so just more conversations like this can be super helpful. Also, the more that people can be open about mental health issues, always helpful. Also, how we talk to our kids about mental health issues can be really helpful. How we talk about our own mental health to our kids, not dumping our bucket, but acknowledging maybe our own struggles to our kids can be really impactful. All of those are small steps that we can do to make an overall more systemic change in our community. As like I said, small Tennessee town, Yeah, never heard the words mental health or that mental health was like even a thing. Even now, I am still very connected in my community and having talks with other professionals. It is still a struggle. And I think the more you guys do stuff like this, the more we as the adults in the community can change that. I think generations to come, I think it'll be different, but we just got to put in the work now.
Yeah. I mean, I think we do see like already, or I notice at least like a big change from even when I was in school and elementary and high school, just the way that kids and teens talk about their mental health. Not all. That's why we're discussing this, because there's some that don't or don't feel comfortable, or that stigma is still there a lot, but it's definitely, it's a little bit better than at least when I was younger. So that's good. And that's why we need to keep doing these. Having these conversations and putting this stuff out there. Pulling all that together and wrapping this up, what is the one thing you wish everyone in our community understood about suicide prevention?
Yes, and I'm kind of embarrassed because I haven't even mentioned it yet, but one of the biggest prevention things that individuals can do, families can do, communities can do, is making sure that people feel connected. The more that people feel connected, the less likely they're going to follow through with any suicidal ideations or suicidality behavior. Why is that? Well, that's because we as species, we as human beings are social creatures. And if we feel that we are not connected, that takes away some of our innate preventive characteristics that we have. And so the more that we can have and show belonging to our kids, to our adult peers, to our community, the less likelihood there is for the suicide.
Sure. No. Well, thank you so much for being with us today, Emily. This has, I think, been really good, and hopefully we can have other conversations in the future too about a lot of this stuff, because I think it is so important, and just being in this community and wanting to really do our part and give back. And I really appreciate you doing that as well, and doing what you do all the time. So
thank you. I love what I do. I hope that comes across, because I absolutely love this job. I think all the time, oh my gosh, I get paid to sit and talk to really cool people and meet and have this influence in the community and get to share my experience. It's lovely. So thank you so much for having me.
No, not a problem. And if you're in our community, they can just go to the Secure Base website, right, to reach out to them there and find you someone that you can talk to like Emily. So don't be scared to reach out. Have a good one.